Jaw deviation is a common finding, especially in patients with problems in the joint area. It mostly causes facial asymmetry. And when investigating the underlying causes of this asymmetry, examining it only by looking from the outside is not always sufficient. Especially something that would cause this kind of deviation in both joint areas. It is necessary to examine the X-ray films to see whether there is excess bone tissue growth, which we call hypertrophy or hyperplasia, or not. If these kinds of issues are absent, then we shift our focus to how this problem can be resolved structurally. Essentially, based on the patient's clinical findings, while we can sometimes manage the aesthetic correction of these jaw misalignments by addressing only the chin point, at other times, sometimes after orthodontic treatment, meaning braces treatment, we may need to apply classic orthognathic surgery, jaw surgery operations. However, regardless of the circumstances, in any case, whether we can solve this by touching the chin tip or whether we can solve this problem with orthognathic surgical interventions. In any case, we can clearly present the solution for the jaw deviation to you. In fact, the patient's two distinct issues are frequently intertwined in this situation as well. The first is the aesthetic issue, and the second, if the deviation is very pronounced. Functional problems that emerge due to the compromised relationship between the lower and upper dental arches. Therefore, when we treat the jaw deviation, we will have solved the aesthetic problem, and we will have resolved the functional issue concurrently. Please understand that these surgical procedures are not something to be afraid of. They are quite straightforward operations. They are surgeries we do very easily and have much experience with.